These are difficult decisions, but we have to make them if Medicare is going to be sustainable for the long-term future. A decade ago, Medicare was costing us $8 billion. Today it costs us $20 billion. In a decade's time it will cost us $34 billion. Unless we take some tough action, these costs are going to spiral out of control. Now, this is a government which is serious about economic reform. We're serious about budget responsibility. It seems that the Labor Party and the Senate are just not prepared to accept any tough decisions, and that puts our nation in a very difficult position. It puts Medicare in a very difficult position.
But do you concede, though, as the doctors say, that this will mean for so many people they'll be paying an extra $20 themselves, the patients, for consultations?
Well, Nick, just a few months ago, the AMA was saying that they didn't want to see 6-minute medicine. They didn't want to support bulk billing clinics. They wanted to see doctors spending more time with their patients, and that's exactly what these changes are designed to produce. Exactly how much patients are charged is always a question for the doctors, but these government changes are designed to try to ensure that doctors spend a reasonable amount of time with their patients.
The law of unintended consequences, though, it should also force more people to go to emergency departments and clog up emergency departments. Had you thought of that, and how are you going to prevent that?
Well, you know, Nick, I was a health minister for 4 years and I'm very familiar with these arguments. It's often alleged that issues with general practice mean that people go to emergency departments instead. Anyone who's been to an emergency department knows that there is a system called triaging, and if you don't have a serious complaint, you wait, sometimes quite a long time.
But that really doesn't help the emergency department, though, coping with it when they've got so much other work.
But what the emergency departments do is that they see people in accordance with the seriousness of their condition, and if someone goes into the emergency department with what is essentially a GP problem, well, they will wait quite a long time. That's always been the case. One thing that was done by the Howard government in my time as health minister was we tried to co-locate after-hours GP clinics with emergency departments so that patients going to hospital with GP-type complaints could be seen by GPs.